I need to tell you something that could literally save your life tonight. Right now, millions of people are mixing medications with alcohol without realizing they're playing Russian roulette with their health. And I'm not talking about rare prescription drugs. I'm talking about medications sitting in your medicine cabinet right now. As a pharmacist, I've seen the consequences firsthand. Emergency room visits, liver failure, even deaths. All because someone thought one drink wouldn't hurt. But here's what most people don't understand. When you mix certain medications with alcohol, you're not just doubling the risk. You're creating an entirely new chemical reaction inside your body. So why doesn't everyone know about this? Because most people never read the warning labels. They assume if it's over the counter, it must be safe. That assumption sends thousands of people to the hospital every single year. Let's start with the most common culprit. Pain relievers. You know the ones I'm talking about. Ibuprofen, acetaminophen, aspirin. They're in every household in America. And when you combine them with alcohol, the results can be catastrophic. Take acetaminophen, for example. You probably know it as Tylenol. It's one of the most widely used medications in the world. Seems harmless, right? But here's the terrifying truth. Your liver processes both acetaminophen and alcohol using the same enzymes. When you take them together, your liver gets overwhelmed. What happens next is brutal. The acetaminophen breaks down into toxic compounds that your liver can't handle. This leads to acute liver damage. In severe cases, complete liver failure. And this isn't some rare side effect. Studies show that acetaminophen combined with alcohol is one of the leading causes of acute liver failure in the United States. But it gets worse. You don't need to be a heavy drinker for this to happen. Even moderate alcohol consumption, combined with regular acetaminophen use, can cause serious damage over time. 3 drinks a day while taking acetaminophen regularly? You're asking for trouble. Now let's talk about ibuprofen and other NSAIDs. These are nonsteroidal anti-inflammatory drugs. Common brands include Advil, Motrin, and Aleve. When you mix these with alcohol, you're setting yourself up for gastrointestinal bleeding. Here's why this happens. Both alcohol and NSAIDs irritate your stomach lining. Alcohol increases stomach acid production. NSAIDs reduce the protective mucus layer in your stomach. Put them together, and you're creating the perfect storm for ulcers and internal bleeding. The symptoms can be subtle at first. Stomach pain, nausea, dark or bloody stools. But by the time you notice these signs, significant damage may have already occurred. Some people end up in the emergency room with severe gastrointestinal bleeding, requiring blood transfusions. Moving on to something even more dangerous. Sedatives and sleeping pills. We're talking about medications like Ambien, Xanax, Valium, and even over-the-counter sleep aids like Benadryl. This combination isn't just dangerous. It's potentially lethal. Both alcohol and sedatives depress your central nervous system. They slow down your breathing. They impair your coordination. They cloud your judgment. When you combine them, these effects multiply exponentially. Your breathing can slow to dangerous levels. You might stop breathing altogether in your sleep. This is how many accidental overdoses happen. Someone takes their prescribed sleeping medication, has a few drinks, and never wakes up. It's not intentional. They just didn't understand how these substances interact. The medical term for this is respiratory depression, and it kills people every single day. What about antidepressants? This is where things get complicated. There are several types of antidepressants, and each one interacts with alcohol differently. SSRIs like Prozac and Zoloft can increase drowsiness when combined with alcohol. But the real danger comes with older antidepressants called MAOIs. MAOIs include medications like Nardil and Parnate. When you drink alcohol while taking MAOIs, you risk a hypertensive crisis. That's a sudden, dangerous spike in blood pressure that can lead to stroke or heart attack. Certain types of alcohol, particularly red wine and beer, contain tyramine, which triggers this reaction. Even with safer antidepressants, alcohol interferes with how well the medication works. Depression and alcohol don't mix well to begin with. Alcohol is a depressant. It worsens the very symptoms you are trying to treat. Plus, it can make your antidepressant less effective, leading to breakthrough symptoms. Now here's something that surprises most people. Cold and allergy medications. Yes, even these seemingly innocent drugs can cause serious problems when mixed with alcohol. We're talking about medications containing diphenhydramine, the active ingredient in Benadryl, or pseudoephedrine, found in Sudafed. Diphenhydramine causes drowsiness on its own. Add alcohol to the mix, and you're looking at extreme sedation. Impaired motor skills. Slowed reaction time. This combination is particularly dangerous if you need to drive or operate machinery. Many people don't realize they're impaired until it's too late. Pseudoephedrine works differently. It's a stimulant that raises your blood pressure and heart rate. Alcohol also affects your cardiovascular system. Together, they can cause irregular heartbeats, elevated blood pressure, and increased risk of heart attack or stroke, especially in people with existing heart conditions. Let's talk about antibiotics. Most people think antibiotics and alcohol just make the medication less effective. While that's partially true, some antibiotics create much more serious reactions. Metronidazole and tinidazole are prime examples. These are commonly prescribed for bacterial infections and parasites. When you drink alcohol while taking these antibiotics, you experience what's called a disulfiram-like reaction. The symptoms are brutal. Severe nausea and vomiting. Flushing. Rapid heartbeat. Chest pain. Difficulty breathing. This reaction can occur with even small amounts of alcohol, including alcohol in mouthwash or cooking wine. The reaction happens because these antibiotics block the enzyme that breaks down alcohol in your body. Toxic byproducts build up, causing these severe symptoms. The reaction can last for hours and, in rare cases, can be life-threatening. That's why pharmacists always warn patients to avoid all alcohol when taking these medications. What about diabetes medications? This is critically important. If you're taking medications like insulin, metformin, or sulfonylureas, alcohol can cause dangerous drops in blood sugar. This condition, called hypoglycemia, can lead to confusion, dizziness, seizures, and even loss of consciousness. Here's why this happens. Your liver normally releases stored glucose to keep your blood sugar stable. But when you drink alcohol, your liver prioritizes processing the alcohol instead. It stops releasing glucose. Meanwhile, your diabetes medication is still working to lower your blood sugar. The result? Your blood sugar can plummet to dangerous levels. The scary part is that symptoms of intoxication and hypoglycemia look similar. Confusion. Slurred speech. Unsteady gait. Someone might think you're just drunk when you're actually experiencing a medical emergency. Without treatment, severe hypoglycemia can cause permanent brain damage or death. Blood pressure medications present another serious concern. ACE inhibitors, beta blockers, and diuretics all interact with alcohol in different ways. Alcohol causes blood vessels to dilate and can lower blood pressure. When combined with blood pressure medications, this effect intensifies dramatically. Sudden drops in blood pressure lead to dizziness, fainting, and falls. For elderly patients, falls can result in serious injuries like hip fractures or head trauma. Additionally, alcohol can interfere with how well these medications control your blood pressure, leading to poor disease management over time. So what should you do with all this information? First, always read medication labels carefully. Look for warnings about alcohol consumption. If you're not sure, ask your pharmacist. That's what we're here for. We can tell you exactly how long you need to wait after taking a medication before it's safe to drink. Second, be honest with your healthcare providers about your alcohol consumption. They're not there to judge you. They need accurate information to prescribe medications safely. If you drink regularly, certain medications might not be appropriate for you, and your doctor needs to know that. Third, understand that even small amounts of alcohol can cause interactions with some medications. One drink might seem harmless, but with certain drugs, even that single drink can trigger serious reactions. When in doubt, skip the alcohol entirely while you're on medication. Remember, medication warnings aren't suggestions. They're based on real medical evidence and real cases of harm. Every year, thousands of people ignore these warnings and end up in the emergency room. Some never make it out. Don't become another statistic. If you're currently taking any medications and drinking alcohol, talk to your pharmacist or doctor immediately. They can review your medications and give you specific guidance. They might need to adjust your dosages, switch medications, or help you understand exactly when it's safe to drink. Your health is too important to gamble with. These interactions are preventable. All it takes is awareness and making informed choices. The next time you reach for that drink while on medication, remember what you learned today. That moment of pause could literally save your life.